Smith. How are
Hello.
you?
Good, how are you?
Good. My name's Amanda. I'm going to be your nurse practitioner today. So, what brings you in?
Experiencing a lot of headaches, and they seem to be pretty regularly at right around the 3 p.m. time.
Okay. So, just kind of headaches every day at 3 p.m. Uh-oh. So, when did you notice that this started?
It's been like that for the last week or so. It's just,
A week?
Yeah.
Okay. Had you ever experienced it before in the past?
No, just kind of, now it's kind of happened.
Okay. Do you remember what you were doing when you noticed that you were having these headaches consistently at 3 p.m.?
Just at work, drink with a cup of coffee, normally.
Okay. So is it in your whole head, or is it just the front part or the back part?
It's kind of just the head in
general?
Yeah.
Kind of just is it like an aching headache, or is it
It's like a dull ache.
Okay, no sharp pain or anything like that?
No sharp stabbing pains.
Okay. Are you having any pain in your neck?
No.
Just the head?
Yeah, just the head.
Okay. And when you get these headaches, how long do they normally last?
Probably a couple hours.
Okay. And you said it's every day?
Mm-hmm.
Weekdays and weekends?
Yeah.
Okay. So what makes it worse? Is it worse? You said it happens at 3 p.m. Does it get worse if you drink more coffee, or does it get worse with anything that you can think of?
Honestly, I don't really know. I just drink a lot of coffee. I don't really drink a lot of water.
Okay.
So maybe like a coffee or like a pop or something.
Mm-hmm. So when you drink coffee, does it get better after you have another cup of coffee?
I honestly couldn't say.
Okay. So not really sure what makes it better or worse.
Yeah.
The pain's just in your head, it's not radiating anywhere else.
Nope.
Okay. Have you tried any treatments over the counter or anything?
Tried Tylenol and Advil and ibuprofen and nothing.
Okay. And how often do you take Tylenol or Advil?
Pretty much every day that I get the headache, I'll try it.
Okay. And do you take one pill or two pills?
Probably two.
Two, just once a day, or okay. Are you having any other symptoms with these headaches?
No.
All right. Okay, Mr. Smith. I'm just going to go over briefly some of your past medical history and family history, that sort of thing. So I'm just going to be asking you some brief questions. Feel free to answer with yes or no, or elaborate as much or as little as you'd like, okay? When you were a child, did you have any serious illnesses like pertussis?
Just pneumonia.
Pneumonia?
In 2006.
Okay. And were you hospitalized for that?
No.
Okay. And did you have any complications from the pneumonia?
Nope.
All right. And currently, do you have any chronic illnesses like asthma or diabetes?
Nope.
Nope. Are you current with your immunizations?
Yes.
All right. And have you had any surgeries in the past?
It's my appendix in 2011.
Okay. And was that successful?
Yes.
No complications from that?
Nope.
All right. Was that just related to appendicitis?
Yeah, it was just an enlarged appendix. They thought it was best just to remove it.
Sure. Okay. And outside of that, have you ever been hospitalized?
No.
Or any serious injuries that haven't been resolved?
No.
Okay. Have you had any recent injuries? Mild injuries?
Or back muscle from lifting, but that kind of resolved itself.
Okay. Just with time, or did you treat?
I just did like ice and heat.
Okay.
Occasional Tylenol for that.
Gotcha. And are you currently taking any medications?
No.
No prescription meds or over-the-counter vitamins or supplements? Okay. Do you have any allergies?
The CT scan dye.
CT scan dye, gotcha. Any allergies to drugs or food?
No.
Father didn't die. Okay. And are you exposed to excessive amounts of sun or toxic chemicals?
No.
All right. Moving on here to your family, just let me know if anyone in your family has ever experienced any of these illnesses. Your siblings, mom, dad, grandparents, cousins.
Okay.
Coronary heart disease.
No.
High blood pressure.
I believe my dad has high blood pressure.
Okay, and is he still living?
Yes.
Okay. Is he currently being treated for his high blood pressure?
I think he takes medication for it. I'm not 100% certain.
Okay. And any history of stroke?
No.
All right. Any history of diabetes
No.
or obesity?
Just some pretty big cousins.
Big cousins, okay. On both sides?
Just my mom's side.
Okay. And is it complicating their lives? Do they have any other health issues?
I think they're just fat and happy.
Okay. Any history of cancer?
Yeah, my grandpa, my mom's side, had cancer. I think it's liver, prostate, just kind of spread everywhere.
I'm so sorry. Is he still living?
No.
Okay. Did he pass away from complications from cancer?
Yes.
Okay. I'm sorry to hear that. Are your other grandparents still living?
My other grandpa on my dad's side, he passed away in April due to pneumonia.
Oh, I'm so sorry. How are you doing with that?
Pretty good.
Yeah.
Yep.
Was it kind of did you see it coming or was it sudden?
It was pretty sudden.
I'm sorry.
Hmm?
Well, this is a safe place to talk about those feelings too. If you're having any stress from that, it's completely understandable. So moving along here, any kidney disease or liver disease?
No.
All right. Drug or alcohol abuse?
No.
Any mental illness or suicide?
No.
All right. Okay, Mr. Smith, can you tell me what your date of birth
9/27/90,
and your place of birth
Des Moines, Iowa.
and your ethnicity?
White.
White, okay.
Or Caucasian, whichever you want.
Are you currently working?
Yes, part-time at a golf course and part-time student.
Oh, cool. What are you studying?
Business and accounting, UMKC.
Wow, go Roos.
Yeah.
Are you married or in a serious relationship?
Girlfriend.
Okay.
Serious relationship.
Is that going okay?
Mhm.
Any concerns for sexually transmitted infection?
Nope.
Are you sexually active?
Yep.
Okay. Are you using any form of contraception?
Birth control for her.
Okay. Are you currently, do you drink alcohol?
Yeah, occasionally.
Occasionally? So about how many times a month?
It's probably two times a month.
2 times? And how many drinks do you have when you do drink?
Right around 10 to 12.
Okay. Do you smoke cigarettes?
Socially, just every once in a blue moon.
Okay. And do you use any other tobacco products, like chewing tobacco?
No.
Okay. Have you ever used, or do you currently use any amphetamines, like cocaine or
No.
nothing like that?
No.
Okay. All right. And as far as your nutritional status goes, can you tell me what you ate yesterday for your breakfast, lunch, and dinner?
4 eggs and a cup of oatmeal.
Okay.
And then for lunch was chicken and rice and veggies, a protein shake, and then the exact same thing for dinner.
All right. I like it. It's very healthy.
Pretty bland.
Well, it's a good, healthy diet. So you cook a lot for yourself then?
Mhm.
Good. Okay, any financial concerns?
Student loans.
Student loans, gotcha. And do you exercise?
Right around 4 times a week.
Okay, great. And what kind of exercises do you do?
Mainly lifting weights.
Okay. Any domestic violence or physical abuse?
Nope.
You feel safe at home?
Mhm.
Okay. And what are your current goals?
The career going and lose the student loan debt.
That would be a good remedy to that, wouldn't it?
Oh yeah, they go hand in hand for sure.
Great. And what are your goals for this visit?
Mainly finding out why I have these headaches and even more to get rid of them.
Sure, that sounds like a good plan. Okay, Mr. Smith, I'm just going to go through some of, just a review of systems, of your body systems. Let me know if you're experiencing any of these symptoms that I'll be describing, and feel free to elaborate on any of them as well. So, have you had any fever?
No.
Nothing, no chills or night sweats?
Nope.
Any weight loss?
Nope, none of the above.
Okay. Any change in the color or texture of your hair, skin, or nails?
Nope.
Nope. Any sore throat or sore mouth?
Nope.
No toothaches or anything?
Nope.
All right. And have you had a runny nose or stuffy nose?
Last time was July 4th.
July 4th. All right. And was that just resolved on its own?
Yeah, I just drank a lot of water, kind of flush whatever it was out.
Good.
Tried to.
So no trouble breathing out of your nose right now?
Nope.
All right. Any discharge out of your nose or swelling?
No.
Okay. Have you had any changes in your hearing?
No.
Or heard any ringing in your ears?
Nope.
Okay. Any dizziness?
Nope.
All right. Any changes in your vision?
Nope, still 20/20.
Any redness or swelling in your eyes?
Is there any?
No, they look good.
Okay, we're good then.
Any shortness of air? Trouble breathing?
No.
Okay. No cough or anything like that?
Nope.
All right. Have you noticed having to get up to go to the bathroom to urinate more frequently?
No.
Okay. Any racing heart or heart palpitations?
No.
And have you noticed any swelling in your hands or feet?
No.
Or any numbness or tingling in your hands or feet?
Neither.
Okay. Any weakness or loss of coordination?
Just from that one back issue, but that resolved on its own.
Okay. Any GI symptoms? Any upset stomach, nausea, vomiting?
Nope.
Okay. And have you noticed a change in how often? Well, I already asked you if you've seen that. Any changes in your urine or stool?
No. Still pretty much the same.
Okay. And have you noticed any excessive bruising or bleeding?
No.
Okay. Any swollen lymph nodes underneath your armpits or here?
No.
All right. And have you had any confusion or change in your mental status?
Just the headaches.
Just headache.
No confusion with it.
No fainting or loss of consciousness?
No.
Okay. Have you recently hit your head or anything?
No.
Okay. And any changes in your mood
No.
or loss of interest in things you normally like to do?
No. Just when I get the headaches, I get kind of irritable.
Irritable? Okay. Well, that's understandable with a headache. And have you had any allergic reactions to anything?
No.
Okay. Do you have any concerns for sexually transmitted infections?
No.
Any pain in your genital area?
No.
All right. Okay, Mr. Smith. Well, moving forward here, I think what I'm going to do is a focused neurological exam just to see if there's anything going on with your head that we need to be aware of. So I'll be doing a number of tests and just testing some of your cranial nerves and some of your reflexes, okay?
Okay.
So we'll just get started right away with that. I'll just have you wrinkle your forehead and raise your eyebrows, good. And puff out both of your cheeks. All right, and smile real big for me so I can see your teeth. Great. All right, so now I'm just going to have you clench your teeth real tight. Good. I'm just going to come here and kind of feel the muscles on while you're doing that. So clench them real good. Okay. All right, now I'm going to touch a cotton ball to different areas of your face, and I just want you to let me know if you can feel it, okay? And I'll have you close your eyes as well. Okay, and now open your eyes. I'm going to bring this close to your eye, almost touching your cornea, and I want you to let me know, if you can tell, if you can. It's probably not very comfortable. All right. Now I'm going to do it with just the tip of my pen. It's not on, don't worry. So I'll have you close your eyes again.
Mm-hmm. Yep. 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 Yep.
Sorry. All right, great. So let's see. Now I'm just going to have you close your eyes and put out your hand. And I'm going to place an object in your hand, and I want you to tell me what it is, okay? With your eyes closed.
Okay. It's a cotton ball.
Okay.
Pen?
Great. Good job. Okay. Now I'm going to draw a letter or number on your hand, and I want you to tell me which letter or number it is that I'm drawing with your eyes closed, okay?
Okay. F.
Let's try that again.
A.
Uh-huh. Good job.
7.
Uh-huh. Great. Very good. All right, so now I'm just going to have you sit like you are and just rapidly move your hands like this. Great. And I'll have you reach out your finger and bring it to your nose. Great, and with the other hand as well. Okay, and now I'll have you put your finger on your nose and then reach out and touch my finger. Good. Great. Great, good job. And now with your shin, just bring it up and run it down the front, with your heel, bring it up and run it down the front of your shin. Great. Well done. And I'll just have you stand up and place your feet close together so that they're touching. And I'll have you close your eyes and just stand. And I'm going to push you a little bit. Okay. Great. And last thing, I'll have you walk just through the door and back in, okay? Very good. Okay, I'm going to test some of your deep tendon reflexes now. So I'm going to be using this reflex hammer. It's got a rubber, if I can get it out of my pocket, it's got a little rubber thing on the end, so it shouldn't hurt you, but it's to try to elicit a reflex. Okay, so I'm going to do your bicep reflex first. So I'll have you place this hand on top of that one and just kind of relax. Okay, and then same with that. Okay, and now I'm going to do your triceps. So I'm going to reach this out behind you. Let's see, I might have you turn and face that way. There you go. Okay. Do this one. Okay. Now we'll test your brachioradialis. Right. And this one's a little different. I'm going to have you put your knee up on the bench here and kind of stick your foot out behind you. Yeah, perfect. Just going to be checking your Achilles. Is it all right with you if I move this sock down? Okay. I might have to take it off.
It's on there pretty good.
Okay. Oh, that was good. Okay. And we'll do the other one as well. So I'll have you take off that sock too. Okay. And while you have your socks off, I'm just going to also test one more reflex on your foot. So I'll have you put them back up, put one of them back up the way it was. Okay, you see the other one? All right, go ahead and take a seat. All right, Mr. Smith. Well, your neurological exam was great. I didn't see any deficits in your reflexes or your cranial nerves functioning. My recommendation for you, it seems like, well, I forgot to ask you a very important question. How many cups of coffee do you drink a day?
How many are in a pot?
So you drink a whole pot of coffee a day?
Yes.
Okay. And you said you don't drink hardly any water?
Hardly. It's mainly coffee.
Okay.
Like a soda or juice or something.
Okay. So how many glasses a day of water do you think you drink?
3.
Okay. Do you, when you drink your coffee, do you put creamer and sugar in there?
For the most part.
Yeah. Do you put a lot of it in there, or?
A lot more sugar than creamer.
Okay, gotcha. So one thing that coffee can do is it acts like a diuretic, so it can dehydrate you, and it can also, because it has a lot of caffeine in it, it can cause you to crash right around that 3 p.m. time. So, you know, some people get relief if they drink more coffee or a soda around that 3 p.m. time, but again, you're going to end up with that headache, you know, a few hours later anyway. So my recommendation for you would be to try to hydrate more and drink more of just plain water, at least 8 glasses a day. So, you know, you're getting a lot of water from your vegetables that you've mentioned eating, but on top of that, it's important to stay hydrated with just plain water, especially when you're drinking something like coffee that can act as somewhat like a diuretic. So I think going forward, my recommendation would be to see how that goes for maybe a week or two. Try to drink a lot more water, and sometimes carrying a water bottle with you can help. Some water bottles help keep your water cold for longer periods of time. Sometimes people will set reminders on their phone to, you know, remember to drink a glass of water. So I recommend trying that, and you know, the Tylenol and the Advil that you've taken, taking as prescribed or as written on the label, is also good. You know, if you're just if the headache is interfering with your day, which I also didn't ask you, are these headaches, are they interfering with your activities of daily living?
No, I just kind of work through them for the most part.
Okay, all right. Well, because it's not really seeming to impair you to the extent that you're not able to do your job or socialize, that's my recommendation, to just drink more water and maybe try cutting back on the caffeine a little bit if possible, and then come back and we'll recheck you in a couple of weeks. And but what did you have in mind for a treatment, or did you have anything in mind?
Oh, I had no idea of any treatments. I just kind of wanted to figure out what we could do to resolve it.
Sure. So you're just kind of concerned that these headaches seem to be around the clock every day at 3 p.m.
Right.
Okay. Well, I think going forward, that's a pretty good explanation based on what you've told me and what I've assessed. So we'll see how drinking more water goes and cutting back on the coffee goes, and we'll see you again in 2 weeks, okay?
Okay.
All right, thank you. It was nice to meet you.
Yep, likewise.
Just going to test your quadriceps reflex. Oops, sorry. Okay. And normally we would be on an exam table since you're so tall, but we don't have one of those here. Well, that's pretty much what you would do. All right, so patient Mr. Smith is a 27-year-old Caucasian male who appears to be his stated age, and he appeared to be alert and oriented to person, place, and time, and he was cooperative and was a reliable historian. His focused neurological exam showed no deficits in his cranial nerves, 5 or 7 for motor or sensory function. He did not exhibit any abnormalities in his gait. It was fluid and coordinated. Romberg was negative. He was able to complete the rapid alternating hand movements, and as well as the finger to nose and finger to finger tests with ease. And his heel to shin test was also coordinated, and he was able to complete that with ease as well. His deep tendon reflexes, while they were a little bit difficult to elicit because we do not have an examination table here, and the patient was wearing jeans, for the most part his deep tendon reflexes did appear to be intact, and he had no problem with identifying foreign objects placed in either one of his hands, and he was able to properly identify the numbers and letters that were drawn on his hands for stereogenesis and graphesthesia. I did not go over the abdominal or cremasteric reflexes due to patient sensitivity. So what I would have done is I would have had him on the examination table in a gown, and for the abdominal reflex I would have traced my finger or pen down toward his umbilicus from several different regions, and I would have seen his abdominal muscles contract, and the cremasteric reflex I would have gone down the medial inner thigh, and that would have elicited a response as well. His plantar reflex was intact. So overall, his neurological exam was non-remarkable. He did seem to have some issues with dehydration and overcaffeination contributing to his headache problem. So the plan was to increase his water intake, daily water intake, and cut back on caffeine, and to follow up in 2 weeks.